topic of my presentation is role of reactive oxygen species modified human histone H2A in the onset of autoimmunity in patients with systemic lupus erythematosus. Let me start first with a very brief introduction. This is a very brief introduction of systemic lupus erythematosus or SLE, which is basically a multi-system autoimmune disease involving both humoral and cellular aspects of innate and acquired immune system. Protein oxidation of nucleic acids, lipid peroxidation possesses a major impact in SLE. Increased level of circulating autoantibodies have been reported in SLE patients. And these are some of the clinical features of SLE, which are butterfly rashes across the face, fever, anemia, renal, neurologic, cardiac abnormalities, lesions of discard, lupus, and arthritis. In the present study, the commercially available histone H2A was exposed to hydroxyl radical, which was generated by UV irradiation of hydrogen peroxide. And the modified product was characterized by many techniques. Antigenicity of native and ROS modified histone H2A was probed by inducing polyclonal antibodies in experimental animals. Specificities of induced antibodies were evaluated by their binding to various blood proteins, nucleic acids, and their ROS modified conformers. In order to assess the possible role of ROS modified epitopes in the etiology of autoimmune diseases, sera from various SLE patients were studied for their recognition of native and ROS modified histone H2A. Now I quickly move towards results because of the shortest time. This is the UV absorption spectra of native and ROS modified histone H2A. You just see the difference in the absorbance of ROS modified histone H2A and histone H2A. That gives a clear indication that hydroxyl radicals generated by UV irradiation of hydrogen peroxide caused extensive damage to the protein. And these changes in the absorbance of the proteins was further confirmed by taking UV difference spectra of ROS modified histone H2A, which was recorded by using native protein as a reference. This is the sodium dodecyl sulfate polyacrylamide gel electrophoresis of native and ROS modified histone H2A. Here in this case, the lane 1 and lane 4 contains the SDS molecular weight markers, and lane 2 contains the native histone H2A, and the lane 3 contains the ROS modified histone H2A. You just see the difference in the band intensity of native and ROS modified histone H2A. That gives a clear indication that hydroxyl radicals caused extensive damage to the protein. Estimation of protein carbonyl contents is the best way to determine protein oxidation. For that reason, the experiment in this figure was conducted. You just see the difference in the carbonyl contents in bar 1 and bar 2. Bar 1 represents for native histone H2A, and bar 2 for ROS modified histone H2A. So this difference in the carbonyl contents clearly indicating that hydroxyl radicals generated by UV irradiation of hydrogen peroxide caused extensive protein oxidation. Now the generation of hydroxyl radical in the reaction mixture was further confirmed by using mannitol and DMSO, as they are specific quenchers for hydroxyl radicals. So the addition of these mannitol and DMSO in the reaction mixture significantly reduced the carbonyl contents. So this gives a clear-cut indication that the damaging agent in the reaction mixture was hydroxyl radical. And this table shows the complete characterization of native and ROS modified histone H2A under identical experimental conditions. You just see the modification section of this table. 41% hyperchromicity at 280 nanometer, 73.3% loss of the tryptophan fluorescence intensity when the protein was excited at 295 nanometer, which is basically for tryptophan residues. 74.9% loss of the fluorescence intensity when the protein was excited at 280 nanometer, 50 2.1% loss of the band intensity on SDS page, and 80.9% increase in the carbonyl contents. So all of these parameters clearly indicating that hydroxyl radicals generated by UV irradiation of hydrogen peroxide caused extensive damage to the protein. Antigenicity of native and ROS modified histone H2A was probed by inducing polyclonal antibodies in experimental animals. For that, we have immunized rabbits with native and ROS modified histone H2A, and both native and ROS modified histone H2A was found to be highly immunogenic, and this is the evidence for that. This is basically an octalony immunodiffusion of induced antibodies against native histone H2A in figure A, and for B, ROS modified histone H2A. Here in the figure, in both the figure, the central wells contains antigen alone, and well 1 to 6 contains neat 1:2, 1:4, 1:8, 1:16, and 1:32 diluted immune sera, and the precipitant line between the well clearly indicating that both native and ROS modified histone H2A are highly immunogenic in experimental animals. This is the elution profile of affinity purified anti-ROS modified histone H2A IgG, single peak and a single band on SDS page under non-reducing condition, clearly indicating that IgG from the immune sera were perfectly purified. This is the for visual detection of antigen-antibody interaction. This is the gel retardation assay, or simply we call it band shift assay, that shows the interaction of affinity purified anti-ROS histone H2A IgG binding to ROS modified histone H2A. Here in this gel, the lane 1 contains antigen alone, which is ROS modified histone H2A, and lane 6, which is last lane, that contains the affinity purified IgG. And from lane 2 to 5 contains same amount of antigen with increasing amount of IgG. This will lead to the formation of immune complexes, as you have seen in the top of the wells, which causes the retardation in the mobility of unbound antigen, as you have seen in the base of this gel. So this gives a very clear indication that antibodies, that induced antibodies against ROS modified histone H2A are highly specific towards ROS modified histone H2A. Now this table shows the antigen binding specificity of affinity purified anti-ROS histone H2A IgG. You can see the inhibitor section, the ROS modified histone H2A showed maximum inhibition or maximum binding with these affinity purified IgG, which is used as a positive control for the experiment, whereas these antibodies also shows some reaction with native histone H2A. But the most important thing is that these antibodies shows cross reaction with native thymus double stranded DNA, that is ctDS-DNA, and ROS modified thymus double strand ROS modified thymus DNA, and ssDNA means single-stranded DNA. It also shows binding with single-stranded DNA, ROS modified single-stranded DNA, and these antibodies are also shows binding with mitochondrial DNA as well as a ROS modified form of mitochondrial DNA, whereas the blood proteins and their ROS modified conformers showed negligible binding or cross reaction. So by performing this experiment, we got to know that antibodies against ROS modified histone H2A showed similar characteristics as the reported SLE autoantibodies are showing. So in order to assess the possible role of ROS modified epitopes in the etiology of autoimmune diseases, sera from various SLE patients were studied for their recognition of native and ROS modified histone H2A. And this is the direct binding ELISA of 1:100 diluted SLE serum samples binding to histone H2A and ROS modified histone H2A. As you just see the difference between the recognition of the recognition of SLE autoantibodies towards ROS modified histone H2A and histone H2A. That gives a clear indication that autoantibodies from SLE patient recognizes ROS modified histone H2A in a greater extent as compared to its native conformers. And the native and DNA represents for the native thymus double-stranded DNA, which is used as an immunochemical marker for SLE or the positive control for the experiment. And NHS represents for normal human sera that showed negligible binding with either of the antigen. So by performing this experiment, we got to know that SLE autoantibodies recognizes ROS modified histone H2A in a greater extent as compared to its native analog. Now for further confirmation, we have performed the competitive binding assay, and this is the competitive binding assay of SLE that shows the SLE autoantibodies binding towards histone H2A and ROS modified histone H2A. Here in this case again the native thymus double-stranded DNA was used as a immunochemical marker for SLE or used as a positive control for the experiment. You just see the mean plus minus SD values for native histone H2A and ROS modified histone H2A. That gives a clear indication that autoantibodies from SLE patients recognizes ROS modified histone H2A in a greater extent as compared to native histone H2A. Again, for visual detection of antigen antibody interaction, the gel retardation assay was performed, and this is the gel retardation assay that shows the binding of SLE autoantibodies towards ROS modified histone H2A. Here again the lane 1 contains the antigen alone, which is ROS modified histone H2A, and lane 6 contains the affinity purified SLE IgG, and from lane 2 to 5 contains same amount of antigen with increasing amount of IgG. This will lead to the formation of immune complexes, as you can see in the top of the well, which causes the retardation in the mobility of unbound antigen. So all of these experiments clearly indicating that antibodies from SLE patients recognizes ROS modified histone H2A. Now this is the first study around the globe that shows the ROS modified histone H2A in the onset of autoimmunity in patients with systemic lupus erythematosus. Our novel results provide an important insight into the immunological basis of anti-DNA autoantibodies generation in SLE. And finally, I thank to Dr. Abdullah and Mr. Fahad Al-Oraini, as they have made lots of chemical ordering for me. Thanks are also due to King Abdulaziz City for Science and Technology research grant for funding. And I never forget to acknowledge my postdoctoral bosses, Professor Haki and Professor Singer. And these are my overall publications, and few I have published from the college, and rest were from my postdoctoral work. The publication on page 1, on page 2, on page 3, on page 4, on page 5. And thank you for your listening.
Thank you, Dr. Zafar. Any comments or questions?